Welcome to the Making Educators Partners in Youth Suicide Prevention training. I am Jason Byers with the Griffin Spalding County School System, and I will be providing this important workshop today. SPTS is a 501c3 nonprofit organization founded in 2005 by two fathers, Scott Fritz and Don Quigley, who lost their teenage children to suicide within 2 months of each other. Once the shock of their losses had worn off, Scott and Don realized they had no idea that suicide was the third leading cause of death for youth 10 to 25 years of age. They committed themselves to increasing awareness not only about the reality of youth suicide as a problem, but also empowering all members of the public to step up and become involved in youth suicide prevention. The mission of the Society for the Prevention of Teen Suicide is to reduce the number of youth suicides and attempted suicides by encouraging public awareness through the development and promotion of educational training programs. As one of their first steps in meeting this mission, Scott and Don were instrumental in having the first legislation passed in the country in 2007 in New Jersey to require all educators to receive 2 hours of professional development credits in youth suicide prevention, and this is some of the training content I will be sharing with you today. There is also a free online version of this training available at the SPTS website, and I'll give you information on how to access this at the conclusion of our meeting today. Today, we're here to learn about youth suicide. I realize that this may be a difficult topic for some members of the audience, and that most of you can probably think of somewhere else you'd rather be. I'd like to start this presentation by asking you to think about the following question. If I could be anywhere in the universe right now, instead of sitting in this room listening to a talk about suicide, I would be. Some people watching this will have a personal relationship with suicide. They will have known a friend, family member, or student who completed suicide. Some people will themselves have thought about suicide as an option at one point in their lives. If the content of the program today becomes too personal or difficult, go to that other place in your imagination to avoid being stressed. This ability to use our imagination creatively when we are in places we don't want to be is actually a resiliency skill called self soothing. It is an important coping skill to keep in your bag of tricks, and it can really calm you and help recharge your emotional battery when you feel depleted. If the same question were asked of a suicidal student, the answer would not be about a fun or distracting activity. Most likely, the answer to where would you rather be would be, I don't know, or I'd rather be dead. Suicide children lose the ability to use fantasy in productive ways. This gives you a little insight into how suicidal youth lack the capacity to use their imagination to soothe themselves. It takes them, instead, to a dark place. This training will review the ways in which suicide awareness training is beneficial to your schools and community. It will correct myths and misinformation about youth suicide, present accurate, evidence based data about suicide risk, warning signs, and protective factors, outline your role in the prevention process, discuss ways for dealing with at risk youth, and identify additional resources, especially those that are web based. How pervasive is the problem of youth suicide? Here's a brief review of what national data tells us. Suicide is the third leading cause of death for teens and the second leading cause for college age youth. A recent survey of high school students found that almost 1 in 5 had seriously considered suicide. More than 1 in 6 had made plans to attempt suicide, and more than 1 in 12 had made a suicide attempt in the past year. In Georgia in 2013, 1,212 Georgians died by suicide. 73 youth between the ages of 10 and 19 years old died by suicide, and it was the third leading cause of death for 10 to 24-year-olds. The overarching role of your school in the prevention of any youth self destructive behaviors is to maintain what is called a competent community. The role of your school is critical and limited and falls within your school's mandate to provide a safe learning environment for all students. Schools must provide the resources and build competencies for helping to teach everyone in the school to better recognize kids who may be at risk for suicide, not to become experts in risk assessment. Your critical role is simply to recognize behaviors that may signal risk and to then refer these youth for more comprehensive assessment by trained mental health professionals. In a competent community, everyone is concerned about the welfare of each other and know how to come to each other's aid. Everyone, from the top administrator to the part time staff and volunteers, are committed to suicide prevention and engaged in activities to support this goal, which include to provide an effective initial response to these students and to know where in the community to refer them for further help. The next part of our competent community consists of education for all staff and volunteers, including administrative staff, faculty, support staff, bus drivers, cafeteria workers, or anyone who has contact with students. Suicide awareness training provides them with a procedure which they can utilize when they are presented with suicidal statements or concerns. By having specific intervention tools and an understanding of their role, training like this empowers them to respond to youth needs in an appropriate and effective manner. The tools which are provided in this type of training also help staff manage feelings of anxiety and fear, which are often generated in these types of encounters. It also reinforces their natural strengths as good listeners and caring, competent professionals. Staff is helped to understand that it is good professional practice to seek out other professionals as resources while helping the youth to access appropriate intervention services in a timely manner. Just as you, as educators, would not expect mental health professionals to understand educational philosophy or teaching methodologies, you do not need to understand the complexities of mental health classification or treatment. Your role is simple, critical, and limited in scope. To learn signs of at risk youth and to use that learning, to identify these students, and to refer them to appropriate resources. Are school programs that address suicide safe? Yes, but let me provide some clarification. When programs for schools were first initiated in the 1980s, the prevailing thought was that they needed to be dramatic to keep youth's attention. Unfortunately, evaluation of these programs discovered that the sensationalized ways in which suicide was presented and the fact that suicide was also discussed as a response to stress increased thoughts of suicide in youth who said they hadn't previously considered it as an option. Subsequent programs were changed and refined and adapted to following the best practice guidelines derived from research. The National Suicide Prevention Resource Center has a list of programs that either have been researched to be both safe and effective or are listed on their best practices registry. Unsafe programs include things like holding large assemblies where individual reactions to the topic cannot be monitored, or any type of program that depicts a death by suicide, or programs where attempters talk about what they did and why they're glad to still be alive. Can talking about suicide plant the idea in the minds of vulnerable teens? The answer is no. Unfortunately, this question represents one of the most common myths about suicide, that discussing it can give kids ideas about doing it. That's just not true. just like talking about diabetes doesn't cause diabetes. Whether or not we like to admit it, suicide is a tragic reality in the current life of our students. If you were to ask a classroom of high school students, for example, if they know anyone who has attempted or completed suicide, between 75 and 100% would probably respond affirmatively. Suicide is a frequent topic in the media and is one of the most significant public health problems of our time. Talking about suicide provides an opportunity to address stigma and correct misinformation. It can also enhance coping strategies that help students deal with long term social problems. Finally, if you think about the power that keeping a secret can have, you can begin to appreciate how not talking about suicidal thoughts or feelings can actually increase their intensity. You need someone who will talk openly about suicide and help them get help finding an alternative to suicide. It also helps them feel less alone. Talking directly about their suicide thoughts tells them that someone cares and is willing to help. And once the topic is broached with students, it's really essential that your school has trained resource staff who can follow up. Remember, your job is simply to learn enough information about suicide to be able to identify students who may be at risk and then refer those students for further assessment. Is talking about suicide just a way for someone to get attention? No. Talking about suicide is something to take seriously. Sometimes the way youth talk about suicide is indirectly, through their writings or artwork. Pay attention to these types of communications from your students. Ask the student about anything that gets your attention if it is out of the developmental norm or especially violent. Not every inquiry will need to be followed up, but if you get an answer that concerns you, keep your eyes open for other signs of suicide risk, which we will cover soon. If a youth talks about suicide as a way to get attention, then you're dealing with a youth whose problem solving skills are pretty compromised. Suicide isn't a socially acceptable way to solve problems or get attention. Any youth who talks about suicide, whether or not the threat is perceived as serious, should be referred to identified school resource staff. One of the essential tenets in the education field is that a problem well defined is a problem half solved. In order to ensure that all members of the competent community are on the same page in their basic understanding of suicide, the above definitions are provided. The first definition of attempted suicide is what is accepted by the World Health Organization and the Center for Disease Control and Prevention. This second definition of suicide is used because it frames the act of suicide in a cognitive behavioral context and suggests opportunities for intervention. Suicide is often viewed as an alternative. Viewing suicide from this perspective helps us understand suicide as less than a wish to die than a wish to escape the intense emotional pain generated from what appears to be an inescapable situation. We may ask the youth, what's going on in your life right now that has you feeling so terrible you think death is the only answer? It is really not helpful to present students with the cliche that suicide is a permanent solution to a temporary problem. First, that response is trite. And secondly, the way in which kids perceive the message of time is different than adults. The future is immediate, like tomorrow or the weekend. So, if I had a problem a month ago and I still have it today, it seems like it has been there forever. Crisis thinking colors problem solving ability. When we think of a crisis as any situation in which we feel that our skills do not meet the demands of the environment, we realize that the crises can be frequent visitors in most of our lives. And we can also realize that most of us do not do our best problem solving in crisis situations. Person who is suicidal is also often ambivalent. What this means is that the person is feeling two things at the same time. A part of them wants to die, and a part of them wants to live. When talking with a suicidal youth, we must acknowledge both of these components. While we line up with and unequivocally support the side that wants to live, this can't be done by ignoring or dismissing the side that wants to die. Most of us want to be reassuring and tell someone who wants to die things like, no, you don't really mean that, or you've been through harder things before. When the three most important words and the most difficult to say are simply, tell me more. Suicidal solution has an irrational component. This is probably the hardest element of suicide to understand, especially from the perspective of rational thought. What happens in the moment someone is suicidal is that their survival instincts disconnect. Even if it just happens for a second, if it means for the suicide or lethal, that's all it takes. Survival instinct is so profound that it is really impossible to conceptualize what must be going on in someone's brain for this primitive instinct to be shut off. Since we can't understand what seems to be this irrational component, it is usually more helpful to talk rationally about the reasons the person may have for living rather than trying to address the irrationality about dying. Suicide is a form of communication. For people who are suicidal, normal communication has usually broken down, and the suicide attempt may be the person's way of sending a message or reacting to the isolation they feel because their communication skills are ineffective. The question that addresses the breakdown can be phrased in the following way: who did you want your suicide attempt to send a message to, and what did you want that message to be? As I said before, there is always a lot of talk about the risk factors and warning signs for suicide, but there is sometimes confusion in how to tell one from the other. It's really important to know the difference because there are many kids and adults who have risk factors for suicide without being at risk for suicide. To make this clear, let's conceptualize these differences in suicide risk factors and warning signs by using the model of a traffic signal. Consider the risk factors like the yellow light that tells us when we need to slow down and pay attention. And the warning signs is similar to the red light that signals we need to stop immediately. There is also a green light to consider. These are what we call protective factors that can serve as a buffer against suicide risk. Let's consider each of these separately. This is the model of suicidal behavior that is called the overlap theory. When we're looking at the yellow light or risk factors, one of the first things to remember is that there is never just one risk factor for a suicide. Every suicide is multi determined. That means that there's always a combination of interactive factors underlying why the suicide happened. This model has been adapted to include some of the evidence based risk factors for youth suicide. Let's look briefly at each element individually. Demographic factors. When we're talking about age, youth between 15 and 19 years of age and white males have the highest suicide rates, and African American females have the lowest. As we noted earlier with children ages 10 to 14, the suicide rates have increased. Sexual orientation or gender identity can be a risk factor because of the victimization, rejection, and isolation that sexual orientation and gender identity can bring. Because this is such a relevant topic, consider visiting the Trevor Project. The Trevor Project is the foremost national resource for LGBTQ community. Clinical factors. Psychiatric history. Many studies have shown that a large percentage of people who die by suicide had some type of mental health disorder prior to death. Drug and alcohol use. Obviously, youth have a history of drug or alcohol abuse or in a more vulnerable category, and previous attempt. A previous attempt, especially when it's combined with other risk factors, is one of the most serious risk factors. Family history. A personal history that includes physical or sexual abuse elevates risk, as does a family history that includes suicide. Recent exposure. Exposure to another suicide, even if it's through media reports or simply the death of a peer by any means, also fits into this category. Recent severe stressors. In combination with these other factors, the experience of stressful life events can also exacerbate the risk. Other risks include youth involved in bullying. Our current research is supporting the fact that youth involved in the cycle of bullying, from bullies, youth who are bullied, and to youth who are both the target and perpetrator of bullying, are at elevated risk of suicide. Certain personality factors can also elevate risk. Youth who are impulsive, immature, or anxious warriors tend to have the poor judgment and compromised problem solving skills, which can increase risk. We also need to be concerned about kids who display aggressive behavior, especially outbursts of rage. Access to means is the most preventative risk factor. A study in Illinois determined that removing access to lethal means, especially guns, was effective in lowering the rate of youth suicides. With younger adolescents, it's also recommended to remove access to the over the counter medication acetaminophen, since it's one of the most common medication used in overdoses. And while it isn't always fatal, one of its unrecognized consequences is serious liver damage. This image reflects the way these risk factors must come together in order to escalate to a warning about an imminent suicide. What is helpful about this analogy is that it also offers a clue for prevention. If we change the intensity of just one of those risk factors, the perfect storm of risk no longer exists, and we can get the person the help to stay out of harm's way. And one of the most effective ways to lower risk is to recognize when students are at elevated risk and get them to a resource person who can assist them in developing more permanent risk reduction strategies. The word FACTS provides a helpful acronym for identifying these red light or warning signs. F stands for feelings: hopelessness, worthlessness, despair, emptiness, feeling anxious or trapped. These are examples of feelings that should really concern us. A. A indicates actions and includes things like trying to get access to a gun or pills, reckless behaviors, increasing drug or alcohol use, and fighting. Changes are indicated by C. This is a very important category because it means we are looking for changes from the student's previous attitude, moods, or behaviors. Students who were active may become withdrawn, quit athletic teams, stop paying attention to personal appearance, daydream, or fall asleep in the classroom, or simply cut class. Concentrating on recognition of changes from previous behaviors is the real key to making assessments in this category. Some students actually make or intimidate threats, which are represented by the letter T. These can be specific, like verbal statements of intent, like "I'm tired of living" or "I'm thinking of killing myself," or worrisome innuendos in writing other class assignments. Whether specific or vague, what these threats tell us is that the student is thinking about death or suicide, and that is what escalates our level of concern. Finally, S refers to situations that may serve as triggers for the suicide. While these are not really warning signs, They are the events that might push a youth over the edge. Situations include events like getting into trouble at home, in school, or with legal authorities, personal losses of things like relationships, opportunities, or even of less tangible things like self esteem, or hopes for the future, or any type of life change for which the student feels overwhelmed or unprepared, like moving or the transition after high school graduation. The most worrisome time is between the occurrence of the triggering situation and its resolution, in that period of uncertainty before the outcome is known. These red lights or warning signs are what usually indicate the need for referral for further evaluation of risk by a mental health professional. Students at higher risk are those that are threatening suicide, looking for access to means, talking or writing about death, dying, or suicide, or have previously attempted suicide serious enough to require hospitalization. These are the students you want to make sure you refer to school resource staff for further assessment. While the typical procedure for your intervention with a suicidal student will be to make a referral to your school resource staff, you will sometimes be put in the position of having a direct conversation with a student about suicide. Remember that listening is a critical piece of the puzzle. It can be a lot more powerful than talking. When listening, avoid downplaying their situation. For example, you have a lot to live for, or things will get better tomorrow. If you think about times in your life when you've had a strong feeling and someone close to you ignores it or tells you you don't really feel that way, you know that this type of response only makes you feel misunderstood and unsupported and can shut down communication for good. Let them talk about wanting to die. It can decrease feelings of isolation and increase hopes that someone actually cares. We've talked about the question about whether or not to ask about suicide directly earlier in the training. To reiterate, we validated the fact that asking about suicide cannot plant the idea in the youth's mind, but we also reviewed the fact that if your personal attitudes about suicide would make you really uncomfortable or uneasy about asking the questioning or listening to the youth, this isn't a conversation you want to have. Immediately get this student to someone who's in a better position to help. Even if the student feels better after chatting with you, you must make a referral to your school resource staff for follow up immediately. One of the most significant protective factors for youth is a caring relationship with an adult. And for many young people, that person is a teacher or someone from school. For a kid, it's knowing that at least one grown up has your back and will be there when you need them. While it's certainly great if a kid has a village of adults behind them, the good news is that it doesn't take a village. One trusted adult is enough. Other protections include a sense of connection or participation in the school or in the community, positive self esteem and good coping skills, access to care for emotional or physical problems, or for substance abuse disorders. What's significant about this factor is that it doesn't say that the youth has no problems. It simply says that if there are problems, there is also access to treatment for them. And cultural or religious beliefs that discourage suicide and promote self preservation. Another important thing to remember is that a school that truly functions as a competent community is actually in the position to foster the development of protective factors in its student population. For example, students can be helped to identify trusted adults in their lives and encouraged to participate in school and community activities. They can also be taught, as some current school suicide prevention programs emphasize, that it's okay to ask for help. Students' efforts in school can be acknowledged, something that is critical for students who are marginal performers. And faculty and staff need to be good listeners to both verbal and nonverbal student communication. Today's workshop is really just the start of your competence in your suicide prevention. You want to review your school's policies and procedures to know what's expected of you by your board and administration. But you also want to personally review your attitudes and values about suicide, especially in light of what you've learned today. Ideally, your school would be a competent community when it comes to suicide prevention, where everyone cares about each other's welfare, is aware of potential risk, and knows where and how to get help for those who need it. Finally, take a look at your curriculum to identify ways in which you can incorporate principles of problem solving, help seeking, and engaging trusted adults as partners, not only as resources for suicidal kids, but for all students to support them through all the ups and downs of life. Remember, your role is learning the signs of risk in students, being able to identify at risk students, and then referring students to appropriate resources. Many additional suicide prevention resources exist. Here are a few of them. Thank you for your attention. We leave you with an Irish proverb that reminds us of why becoming a competent community for suicide prevention is so important. Because it's in the shelter of each other that we live.